So good morning, everybody. Welcome back to those of you that were here yesterday, and also welcome to any newcomers. For those of you that were here yesterday, I'm going to go over basically the introductory information that I reviewed, so you can grab a cup of tea or coffee and relax. And I have information for folks who are joining us today that are new. So my name is Michele Caggana, and I, along with Dr. Joanne Bedurtha, are the co-project directors for NIMAC, which stands for the New York Mid-Atlantic Caribbean Regional Genetics Network. Our region includes DC, Delaware, Maryland, New Jersey, New York, Pennsylvania, Puerto Rico, Virginia, US Virgin Islands, and West Virginia. So we have 10 jurisdictions, and there are 7 regional genetic networks across the country. So you're going to hear about things that we do and throughout the day, and we have a schedule for you that I will review in a minute. So this year, our meeting is entitled Expanding Access to Genetic Services, Sharing Strategies and Finding Solutions. So we ended up getting more registrations overnight. So now we're up to about over 370, I believe. And so thanks for some of you that must have told your friends to go ahead and register. We appreciate it. And we're happy that you're all here to join us. We are hoping we can provide you with some new information that enhances not only your knowledge, but also gives us an opportunity to learn from your perspectives. And as I said, I'll go over what we did yesterday, and it was a very good couple sessions that we had. So I'm glad you're here, all the stakeholders in our region, whether you're parents, physicians, newborn screening, public health, and on and on. And I will go over the meeting after this poll. So one thing that I was interested in finding out is yesterday we had noted that there were about 40% people who were new to the meeting this year who hadn't attended a NIMAC meeting previously. And so now I want you to please answer the following questions. Were you here last year? And again, is this your first NIMAC meeting? So we can do that quick. Okay, so I will go over some of the introductory materials I said I went over yesterday. I want to first introduce our advisory committee and also our NIMAC team members. They're all listed on this slide. We especially want to thank and acknowledge FACMG Otubu, who's our program officer from the Health Resources and Services Administration. We call that HRSA in the lingo. So HRSA funds all of the 7 regional genetics networks, many of the newborn screening things, as well as the National Coordinating Center. We also want to thank Megan Lyon, who is the lead for the NCC. Throughout the meeting, you're going to see our team with our NIMAC teal background logos, and some people have really cool kind of circles like around their face. I haven't figured out how to do that myself yet. But feel free to reach out to any of us if you have any specific questions about the meeting or logistics or NIMAC in general. In addition to the team members that are listed on the slide here, we also had a group as a planning committee. We worked with this group about over 6 months to create the content and the format for the meeting. So I wanted to make sure that they were acknowledged and thank them. Dr. Raylan Forsyth will be talking, I think, in the next session. She's a medical and biochemical genetics fellow at the Children's Hospital in Pittsburgh. Maria Isabel Frankenberg is a consultant to NIMAC. Dr. Elisa Munoz is from the Albert Einstein College of Medicine and Children's Hospital at Montefiore in New York City, the Bronx. Lisa Richard is a parent who is from the Center for Family Involvement at VCU. Rosiani Sanchez, and you've seen, I think, some of these folks spoke yesterday on the video clips. Rosiani Sanchez is the project coordinator from Family Voices National. She is the lead for our team from Puerto Rico. And then Dr. Jerry Vockley is a world-renowned medical and biochemical geneticist, also at the University of Pittsburgh. So I wanted to make sure they all got thanked and acknowledged. You've already met Erica, but I also wanted to extend a thanks to Erica and her event production team. Chris, Fred, Anna, and Kenzie have all worked with us and partnered with us again this year to produce our virtual meeting. Experts in Zoom, and also, as you've seen yesterday, in creating opportunities for collaboration, fun activities, many meters, polls, and all that sort of thing. So all of that makes the meeting more interactive and makes it easier for us to pay attention all day. So as she said, they're going to be handling the behind the scenes, and feel free to put things into the chat. They're also going to be pasting questions, links, and information that will assist you in navigating throughout the day today. So reach out to them if you're having any issues. So I wanted to review yesterday for those who weren't here. We began our day with 2 vendor collaborator lectures from Lynn Perry, who's a parent who's worked closely with NIMAC for a long time, and Dr. Ashutosh Kumar. There will be there were 2 more this morning, and there'll be more this afternoon as well. Then Alyssa gave an overview of NIMAC and showed some of our team products, video clips from stakeholders, and I wanted to thank Kenzie for being the videographer extraordinaire and getting all those videos up for us. We also held our first collaboration corner, and we'll have another one today. And then we had an informative and interactive session on collaborating with stakeholders with Alyssa and Molly, and an exercise in DIVE, data, intention, value, and emotion, which helps all of us understand each other better. And then we ended the day with an impactful session on diversity, equity, inclusion. It was a great panel, and everyone always really likes to hear stories from people, and the panel answered everyone's questions very thoughtfully and with great poise. So today we have, again, we had our 2 lectures, and we're going to have another one at about 12:45. Then we're going to have 2 concurrent sessions, one on genetics and primary care, and the other on emerging treatments for genetic conditions. Then that'll be followed by another collaboration corner session, and so come visit our booths. I know there's some virtual platforms where you technically walk around to booths, but here you can click on to join those different and learn about NIMAC, some of our teams, and our vendors and exhibitors. Then we'll have 2 concurrent public health sessions. One will be on health equity and precision medicine, and the other will be a panel discussion on newborn screening with various stakeholders. And you'll have a chance to grab lunch and listen to our vendor sessions. We'll have one on urea acid cycle disorders and one on family whole exome sequencing and what people need to understand and know about. And we're going to wrap up with 2 concurrent sessions on novel models of service delivery. One is centers on creating efficiency in clinics. Since we're lacking genetics providers, we want to be able to create efficiencies in the clinic itself. And the other is a panel on lessons learned in telegenetics. And then these will be followed up finally by a workshop on creating new service delivery models. And then after that, the wrap up, you can unwind and join some rooms to have further discussion after the day ends. So housekeeping items, the open sessions, as you've seen, are being recorded and will be available. The breakout rooms are not recorded. They're usually short conversations, and most of the recordings and slides will be made available, so you can view them after the meeting. And for those of you, I'll go over this in a minute, but there are CME available, and you will also be able to get CME or CEUs if you couldn't join all the sessions today. But we have to do some things after the meeting. So look for an email from us, and that will give you the information on how to collect your continuing education credits. So from the genetic counseling perspective, this whole meeting is, we can offer up to 8.17 category 1 contact hours. You have to be logged into the live webinar to get credit. We have to be able to provide a list of attendees. We're paying for the CEUs, so this is how we show your attendance. So there's no codes. You don't have to enter or write down any codes after the sessions. You'll get information after the meeting that'll tell you how to get your credit, and we'll put up reminders during the day. You have to document your participation and then do a self-report and online evaluation. And you'll need, obviously, your user ID from the NSGC to be able to do this activity. For people who are getting credit from ACMG, the ACMG the meeting has fulfilled the accreditation requirements with the Accreditation Council for Continuing Medical Education, or the ACCME, and ACMG and the NCC helped us with this to be able to provide 8.25 category 1 credits. This activity will require you to complete an evaluation form, and it has to be done within 30 days of the meeting. They will not accept late credit requests, so 30 days. This slide just discusses how ACMG reviewed all of the financial the financial, commercial influence and promotional bias. As people who do this know, the sessions have to be free of bias. So everything was reviewed beforehand to make sure that all financial relationships were mitigated and that there's no bias in any of the presentations. Everyone has to disclose before their presentation what their financial relationships are. Part of that process is shown on the next, I think, 3 or 4 slides, which is all of the people who are attending the meeting, presenting, or on the program committee or moderating sessions. So their activities are listed and then their disclosures. And I will say the vast majority of our participants have nothing to disclose. This is the next list of our presenters and our participants. And this group has nothing to disclose as well. And the last one is shown here. So thanks to everyone who completed all of this so that we could award CME for this program. This is the information slide about the financial disclosures, and it talks about the things that ACMG had to do to mitigate any financial relationships and the process that they underwent to ensure that everything is out in the open for this. Again, in order to obtain the credit, you have to do a post-meeting evaluation. This is nothing new for people who collect CME for these things. Again, it's 8.25 hours of Category 1 credits. You have, oh, the other thing is you have to do this within, we're going to distribute the information, and you have those 30 days from this date to finish that. So the learning objectives are shown in this slide. Participants should be able to summarize existing resources on genetic topics and new models of care available to primary care providers that can be used in managing patients with genetic conditions. List benefits for a broader engagement of providers, families, and public health entities with families and designing delivery systems for genetics, and identify opportunities for collaboration and resource sharing. I wanted to take just one moment to thank our sponsors who gave us financial backing for this meeting. They're all shown on the slide. Some of them have given some of the vendor talks as well. And then we have another list of collaborators and exhibitors who either have collaboration corner booths or also had done some of the vendor collaborator sessions in the mornings and at lunch. In closing, I wanted to just really thank Pat and Alyssa Terry who did so much of the work to bring this meeting to fruition, and the Marks team for their excellent skills in managing the crowd and keeping everyone engaged and making sure everyone's on time. Please fill out the evaluation forms so we can improve for next year. We read those carefully and we incorporate your comments to make the next meeting even better than the previous one. Please visit our booths, the exhibitor booths, and the NIMAC room will be open during lunch as well, or in the collaboration time. And the more the merrier. Please participate in our polls. They're fun. The content is interactive and it keeps everybody awake and engaged. Please check out our website now and regularly. We continue to populate it with contact. It's nimacgenetics.org. We keep updating with new information on our team projects, and then also we post upcoming events and opportunities. And also check us out on Facebook, LinkedIn, and YouTube. Alicia showed some of that yesterday during her presentation. And it gives information on genetics and awareness days and just information about genetic services. So I want to thank you in advance for joining our social network and also for attending today. Okay, I think that does that. And we're about ready to kick off the sessions for day 2. I'm going to pass it over to Joanne Bedurtha to introduce our first session themed on primary care.